Namaskar दोस्तों, welcome to channel Toxicology on board. Today in this video we'll be discussing another DABT topic, that is red wine, which causes severe headache and hypertension. So let's directly dive into the question. This question is taken from ABT recertification, Diplomat of American Board of Toxicology recertification question paper year 2009. Okay, the question is, which of the following found in red wine can cause severe headache, hypertension without excessive consumption? So we need to identify the components of the red wine. In the red wine, what are the different components are there which are responsible for causing severe headache, hypertension without excessive consumption. In moderate consumption also, these components which are present in red wine, it is going to cause severe headache as well as hypertension. Okay, increase in the blood pressure. Okay, so options we have. Option A is mirceticin, option B is methylxanthine, option C is acetaldehyde, option D is tyramine, and option E is sulfite oxidase. The right answer will be in the green text. That is option D. That is tyramine. Okay. So mirceticin, something which you'll see in the case of nutmeg or mace. Methylxanthine will come across in the case of tea components like xanthine diuretics. Xanthine you'll come across. Acetaldehyde. Generally, you come across in the case of ethanol metabolism. One of the metabolite will be there, and sulfite oxidase that we'll discuss in the next slides. Okay, this is the explanation which is given by the DABT previous students. So tyramine act as a catecholamine. So we have different neurotransmitters will be there. So this particular thing, tyramine, which is present in the red wine, it is acting as a catecholamine as well as epinephrine. So it's dopamine, norepinephrine, noradrenaline, epinephrine, adrenaline. So these are the neurotransmitters, releasing agent causing hypertensive crisis. So this tyramine is going to release these catecholamines, these neurotransmitters from the storage vesicles in between the synaptic vesicles. That you have to keep it in your mind. Okay. So dear citizens, so throughout this video, we are going to discuss two things. One is tyramine we are going to discuss, which is a major component in the case of red wine. And we are also going to discuss about mirceticin, which when it is in combination with the tyramine, how it is going to there is a correlation between these two chemical agents. So we'll discuss. So mirceticin is a naturally occurring insecticide, acaricides. So there are certain insecticides in which one of the component is mirceticin with possible neurotoxic effects on the dopaminergic neurons. So we are discussing about the neurotransmitters also. Mirceticin as a hallucinogenic properties at doses much higher than used in cooking. So in the case of fennel, in the case of nutmeg, there are certain spices are there which contain this particular component. So in that moderate consumption, when you are using in the case of cooking, no, it is not going to cause any adverse effects. But when it is consumed in the larger quantities, for example, if there is a person who want to attempt a suicide and he is taking this insecticide which is containing high concentration of mircetin, at that time it is going to cause this kind of adverse effects. But in moderate consumption in the part of cooking, it is not going to have any hallucinogenic properties. Mircetin act as a weak inhibitor of this monoamine oxidase. So the next subsequent slides we will be discussing about MAO inhibitors, monoamine oxidase inhibitors, diamine oxidase inhibitors also we will be discussing. So before going to the next slide, I would also request you, whenever you are preparing for the DABT, you have to go through Clayson textbook. So in the Clayson textbook, I have checked where this tyramine is present. So tyramine has came across page number 90, that is in Clayson 9th edition. So this is a table 3.4. I have only kept it 12 and 13, the 14 row. I would request you to go back and read the complete table. So different examples are there that you read. So we are sticking only to tyramine. So tyramine here it is mentioned, see, alpha agent receptor, if you see, adrenergic alpha receptor, here it is C. Norepinephrine, cocaine, tyramine. Tyramine, what it is causing? Vasoconstriction, hypertension. So our question is also related to the same thing only. So whenever you're constricting the blood vessel, increase in the blood pressure will be there. Okay. And alpha adrenergic beta 1 receptor also, here also tyramine is present. Okay. It is also causing increased cardiac contractibility and excitability. So pause the video, read table 3.4. Also, I will request you go back to the textbook, lesson 9th edition, page number 90, and read complete table 3.4, like that different examples you read. Okay. So any question with respect to this table in the exam, if you get, you will be able to address it. So as I told you, we'll discuss two different components, that is tyramine as well as mircetin in this particular video. So tyramine is the which is a part of red wine now component. Okay, indirect sympathomimetic displaces catecholamines, dopamine, norepinephrine, epinephrine from the storage vesicles. As I told you, in between this presynaptic neuron and postsynaptic neuron, in the storage vesicles, these neurotransmitters will be there. That is dopamine, norepinephrine, and epinephrine. This tyramine, when you take this red wine, no, from the storage vesicles, these neurotransmitters will be released into the synaptic cleft. When combined with monoamine oxidase inhibitors, with this unregulated catecholamine, which is one tyramine, surge can cause a severe hypertensive crisis. Okay, that is the reason increases the blood pressure. Broken down by MAO in the case of gut. So whenever you take this red wine in the stomach, in the gut, oh, it is getting metabolized. It is broken down by this enzyme, monoamine oxidase. If MAO is blocked by the medication or weak inhibitors like miracetin, now miracetin is coming into picture. You're taking a red wine, and if miracetin is also taken in the form of food components like that, it is going to block the MAO inhibitors. As a result, what happens? Dietary tyramine enters systemic circulation, triggering flood of norepinephrine that constrict the blood vessels and spikes blood vessels. So this is the thing. Here we are seeing why one component, when it is taken along with another component, how it is going to affect. So very quickly we'll go through what is myricetizine also. So myricetizine, naturally compound found in nutmeg maize, exhibits weak MAO inhibiting activity at high concentration non-culinary doses. Means in the cooking, it acts as a hallucinogen. Not in cooking, other than if it is taken in the form of insecticide for a suicidal for that purposes, inhibits MAO but poses a unique nitrogen-free chemical structure compared to traditional pharmaceutical MAO inhibitors. Shows insecticidal and mild psychotropic properties, as I told you. So this is a major component in the case of insecticides also. Its interaction with catecholinergic pathways are heavily dose dependent. At what concentrations? At small doses can be used in spices, but at a higher concentration, it is having adverse effects. So you can pause the video and also see the structure of the tyramine as well as myricetine. This is a chemical structure of tyramine. Tyramine, naturally occurring monoamine, formed by the decarboxylation of this amino acid tyramine. So we have different amino acids, essential amino acids, non-essential amino acids will be there. So tyramine, one of the things. So what is the mechanism? You see how it is causing the toxicity. It enters the sympathetic nerve terminal, as I told you, in between the presynaptic and postsynaptic neuron. Displaces norepinephrine from the storage vesicles. Neurotransmitters will be released into this one, into the synaptic cleft. Release of this large amounts of this norepinephrine, vasoconstriction, increase in the blood pressure. Hypertension crisis, headache. So in the question red wine, it is causing severe headache. Palpitations, because one of the component is contractility of the heart, then chest pain, erythema, and stroke in severe cases. So pause the video and try to read about mechanism. Similarly, in the case of myricetine, myricetine is a naturally occurring phenyl propene compound, a methylene dioxyphenyl propene found in the several plants and spices. As I told you, it is there in the anise, flower, and nutmeg, mace. Next slide, we'll see the examples. So, myricetine, which after absorption, once you consume, after ingestion, metabolism in the liver, that is CYP enzyme. So you have to also remember certain times with related to different CYP isoforms also you'll get some question in the exam. So to active, that is metabolites, MMDA. So MMDA is something related to ecstasy. That is what is a recreational drug. So you have to integrate and read. Okay. So that is the reason it is having hallucinogenic effect. So neurotoxic metabolites will affect the central nervous system, hallucination, agitation, tremors, and seizures. So whenever you're taking the recreational drugs also, no, MMDA, ecstasy, you have to remember those examples also. So at high doses, CNS excitation, myopathy, muscle pain, as well as liver and kidney stress. So serotonergic and modulation is there, dopaminergic modulation. So you have to remember this serotonin, dopamine, all these are recreational type of hormones which are released into your that will give you happiness, that will give you a sensation of ecstasy. You will feel good vibes. Okay, these type of hormones. So this is the comparison I have kept you. You can pause the video and see tyramine and myricetine, mechanism of toxicity and sources, as we told. No, so our question is related to alcohol, that is red wine. Red wine is containing this one tyramine. You can pause and see that in cheddar cheese, as well as in some processed meats also, and certain wines and pickles also, fermented pickles also, tyramine is there. Coming to myricetine, it is there in nutmeg, mace, it is also there in fennel, star anise. So important key points that we have to remember is tyramine hypertensive crisis. It is increasing the blood pressure. And miricetin, it is causing neurotoxicity, hallucinogenic effects at higher concentrations. Risk increases with high intake or drug interaction. So this is miricetin is going to inhibit the MAO, and it is tyramine is going to increase the neurotransmitter into the synaptic left. Awareness of the dietary sources is important in prevention. Okay, so MAO inhibitor drugs, that is phenelazine, tricyclopine or selegiline, are and some antidepressants. And notes miricetin is also a precursor in illicit synthesis of MMDA, that is ecstasy. I told you, recreational drug. Toxicity is dose dependent. Culinary doses means whatever in the cooking, whatever the doses are there, in small amounts is generally safer. Okay, pause the video. See once again what the mechanism of this particular tyramine as well as mechanism of miricetin. Okay, next slide we will see important in the other options which were given in the first slide. No, different options were there. So and also we'll see what are the other red wine components which are responsible for causing adverse effects of toxicity. So red wine toxicity primarily stems from the ethanol content. So once you consume the red wine, one of the major component will be alcohol. So alcohol, when you metabolize by different enzymes, you'll formation of toxic metabolites like acetaldehyde will be there. How they are going to affect the liver, how they are going to cause genotoxic carcinogen, that we will see. So stems from the ethanol content which the body metabolizes into acetaldehyde. Here you can see by the action of the enzyme alcohol dehydrogenase, acetaldehyde is formed. Okay, a highly toxic and genotoxic carcinogen. Pause the video and also read what is the difference between the genotoxic carcinogen, non-genotoxic carcinogen. There might be some video. I'll try to give it in the link. You can go back and check. While red wine contains antioxidants like resveratrol. So we have a misconception that among the people that people will think that consuming the red wine is good for our heart. Yes, you have to understand that there are certain components in the red wine, for example, resveratrol, which act as an antioxidant. These compounds do not counteract the inherent physiological damage caused by the alcohol consumption. So the receptor, the mechanism of resveratrol is completely different from that of the red wine, because alcohol, one of the mechanism is it is causing oxidative stress. As a, on the other hand, red wine is also containing another component called resveratrol, which is acting as an antioxidant. So this is very important. Okay, to understand this one. Pause and try to understand what I'm trying to say. Next, we will say what are the core toxic components. Ethanol, primary hazardous agent. In the red wine, we are discussing. Liver converts ethanol to acetaldehyde, which damages the DNA structures across the multiple organs. So, because you'll be having different types of cancers also, you'll be getting once you excessive consumption of the alcohol is there. So, liver cancer is there, gastric cancer is there, like that. Quercetin. Quercetin is also one of the important component in one of the another component in the case of red wine, a polyphenol unique to red wine. So this is the structure of this particular red wine because it is polyphenol. Okay, when metabolized, it inhibits the enzyme ALD aldehyde dehydrogenase, which is responsible for breaking down this acetaldehyde. This inhibition leads to toxic buildup of LCLD. Whenever the toxic acetaldehyde concentration increases, no, triggering rapid severe red wine headaches. That is the reason in the first slide, the question we have seen that excessive the headache is there. Okay, flushing of headache will be there. Okay, histamine and tannins are also there in the case of red wine. So compounds derived from the grape skin. Okay, these are different sources from which you are getting the red wine. That's why different components will be there. So compounds derived from the grape skin that causes blood vessel dilation, pseudo allergic reaction. There are certain individuals who might be having allergic reaction to this particular histamine as well as tannin component. Individuals with diamine oxidase. So till now we have discussed about monoamine oxidase. So individuals with a diamine oxidase deficiency face an increased risk of severe flushing and congestion. So whenever you consume excess alcohol, no, flushing will be there. Okay, congestion will be there. On your face, you can see flushing, redness, flushing will be there. Then sulfites. So fifth option, we had sulfites in the first slide. You can go back and see the question. So added chemical preservatives are a major trigger for respiratory distress, particularly in the people with asthma. So this particular component is going to, the sulfite oxides are going to cause respiratory distress. Then we'll see some exogenous components which are part of this red wine. Traces toxic elements occur on toxin A, which is a fungal mycotoxin, and trifluoroacetic acid from chemical pesticides are documented contaminants in the case of commercial red wine. So whatever the red wine which is available in the commercial level, no, some of them also contains these two components, toxic elements which act as a contaminants, that is acrotoxin A and trifluoroacetic acid. So So I will request you to pause your video and go back and check. I have uploaded one video with respect to acrotoxin A fungal toxin. Very, very important. Previously, they have asked in DABT question about acrotoxin A, that is Balkan nephropathy. So one question that was asked in the year 2009 only in DABT. And regarding trifluoroacetic acid, there is a publication from the J stage which they have derived permitted daily exposure, and trifluoroacetic acid comes as an impurity in the synthesis of certain pharmaceuticals. So go back and read. If anybody is interested, you can give me the comment. I'll give the article title, so you can read about risk assessment, how to derive trifluoroacetic acid. It was done by Japanese, the permitted daily exposure. So coming back to what are the difference between acute toxicity and chronic toxicity after red wine consumption. So red wine causes, and when on acute exposure of excessive consumption of this red wine, like 2 glass or 3 glass or 4 glass, no, it is going to cause red wine headache. So in the case of our first slide, our question was regarding the headache only. Migraine like pain, facial flushing, nausea occurring within 30 minutes of drinking, driven by the quercetin ALDH2 block. So these are the two things which are after blockage of these two components, it is going to cause red wine headache. Coming to on chronic consumption, when you consume and a larger for up to 1 year or 2 year, you will be getting liver toxicity. So you have like chronic consumption will cause normal liver, fatty liver, inflammation, fibrosis, and cirrhosis. So you can pause the video and see how it is going to cause cancer also, how it is going to cause genotoxic carcinogen. So red wine does not protect against fatty liver disease. So this is a misconception. Continuous intake accelerates inflammation, that is in the GI lining, stomach lining, as well as fibrosis and irreversible cirrhosis in the case of liver. That you have to remember. Coming back to acute exposure, how it is going to affect your intestine, your stomach, is that gastric distress upon on that when you consume 2 glass, 3 glass, no, acute irritation of the stomach lining, risk multiplies dangerously when you are going to use NSAIDs. Like, so whenever you are using along with NSAIDs this particular red wine, it is going to cause more adverse effects on the your stomach lining. Coming to carcinogenesis, this red wine, alcohol has been listed as IARC carcinogen group 1. So in the next slide, I will show you the IARC classification. Very, very important. This is International Agency for Research on Cancer. They have categorized certain chemicals, potential have concern. They have classified them into 1A, 1B. That classification we'll see in the next slide. So alcohol has been listed as group 1 carcinogen. So some of the questions in the DABT, you will be getting about IARC classification also, because this is there in the ABT brochure. It is a part of the syllabus. Coming to diuretic dehydration, how it is going to affect the fluid this balance in the case of red wine upon acute exposure. It is going to cause rapid fluid loss that disrupt the cellular balance and worsen hangover symptoms. So that is about the red wine upon acute exposure. Coming to chronic exposure, cardiovascular damage. As we have seen, some of the components are also causing contractility of the heart, arrhythmia, palpitations. So chronic heavy drinking causes cardiomyopathy, weakening of the heart muscle, high blood pressure, irregular heart rhythms, and arterial fibrillation. So pause the video and see how it is going to cause gastric irritation and how it is going to cause carcinogen as well as cirrhosis. Okay, cardiomyopathy also. So this is what I was discussing about IARC classification, which is given by WHO, International Agency for Research on Cancer, IARC, World Health Organization. So evaluate carcinogen hazard agents. So there are certain chemicals which have potential threat. No, they will do some studies or pool of the literature. Then they have classified chemicals, mixtures, occupational, physical, and biological agents, lifestyle factors. So all these things, how they are affecting the human based on epidemiological evidences also they are categorized. For example, our red wine. Red wine is classified as group 1, means carcinogen to human. How they are saying? Based on the epidemiological evidence, a causal relationship established based on the epidemiological evidence. So they have given the term also. Group 1 is called sufficient evidence of carcinogenity in the case of human. So similarly, we have group 2A, which is limited evidence. Group 2B is limited evidence in humans. Group 3 is not classifiable. Group 4 is probably not carcinogen. Evidence suggesting lack of carcinogen. So here you also have examples also. For example, red meat is group 2A. 2A. Coffee and tea that we are consuming, that is group 2B, very hot. Okay, DDT also a very important thing that they keep on asking in the DABT exam. So it is also classified as group 2B carcinogen. Coming to tea also, it is group 3, and there are certain lead also, inorganic metal, which is group 4 carcinogen. So pause the video and read about these examples, the classification. Okay, these classifications refers to the carcinogenic hazard, potential to cause cancer, not the level of the risk. So that is you have to remember. Okay, so also I will request you, this is a combined slide is there regarding red wine components and its mechanism of toxicity. So if you see ethanol, how it is causing after metabolism, acetaldehyde is formed, which is the major toxic metabolite. Okay, and how the mechanism is, different mechanisms are there. It is going to affect oxidative stress. Acetaldehyde component increases, it is called acetaldehyde toxicity. Inflammation, GI inflammation, organ specific effects. As I told you, it is going to cause neurotoxicity. It is going to cause cardio toxicity, dysrhythmias also, and other effects. And you can see different components and at what doses. And when this alcohol is consumed with some other components also, it is going to cause synergistic type of activity. So one question in the DABT they will ask, alcohol consumed along with CCl4, that is carbon tetrachloride. So then that type of synergistic type of examples and questions they will ask you. So there are certain drugs which are going to inhibit this particular metabolism, or enzyme, this aldehyde dehydrogenase. That type of questions also they'll ask. So here you can see the sources of red wine components. Okay. Um, Hope from this video you were able to understand about the red wine toxicity, its mechanism, the target organs. We discussed in detail about IRC classification also. We have discussed about myristotin as well as tyramine also. Okay. All the best for your exam. Thank you so much.